Hi, everybody. This is part 4 of my series on how to recover from chronic illness faster. So, in parts 1 through 3, we talked about issues including making sure that we're addressing all of the root cause factors that are going on. We talked about IV therapy being a accelerator pedal that can be helpful to get patients cases resolve faster over a plateau faster in some cases when they're well selected. And we also talked about, or I also talked about, working on trying to optimize the physiology of the patient in question. So the fourth thing that I have found, or the fourth because area that I found to be important to address in some cases where patients are either plateaued or not improving as quickly as they would like to, or I would like them to, is making sure that we are addressing all of the underlying health issues that they may have had going on before they became really sick with chronic illness. Now, that might sound like kind of a no-brainer, but it's something that is, in my experience, not always addressed by clinicians across the board. And again, as I've mentioned in previous videos, I've inherited a number of patients over the course of time who've been working with different folks in different parts of the world sometimes. And so they don't always go after those root cause or those rather underlying health issues that may have been there in the first place. Or sometimes it's that patients don't really want to go there. If I'm talking to a patient about their chronic symptoms that developed a few years earlier, they've had lots of debilitating pain and fatigue and neurological symptoms and whatnot, and they say, when I was bitten by a tick with the bullseye rash, or and I've never been well since, despite being on antibiotics or whatnot, or I, was in a really moldy environment, and now I'm really sick with mold illness, and like we need to treat this. I'm sitting there, I'm right there with them, thinking like, yeah, we need to treat those things. But if they also tell me, oh yeah, and I've had IBS for the last 25 years, or I'm really bloated and uncomfortable and super constipated all the time. I'm thinking to myself, yeah, we need to treat that mold illness. We need to treat that persistent borreliosis or whatever it happens to be that seems to be the really in-your-face significant cause of their health issues. However, I'm also thinking if we don't get that gut happier or working better, it's going to be a lot harder to get you feeling 100% because chronic gut issues can set the stage for a body to become more inflamed or debilitated, or at the very least, if your gut's really cranky, you're going to have a hard time absorbing all the nutrients or supplements or herbs or whatnot that might be required to help try to get you better. So great point would be if there are pre-existing chronic digestive issues, it can be really important to address those to help a patient get better faster. Now, there are other underlying health issues that might not be quite as obvious because the gut thing with, well, if you're really inflamed and not absorbing properly, then sure, that makes sense that it might exacerbate your pain symptoms and fatigue and brain fog and things like that. However, there can be other underlying issues outside of digestive tract related symptoms that can also be pre-existing that might also set the stage for the patient becoming more susceptible to those other major drivers of their chronic symptoms, or that might be standing in the way of them getting 100% better as quickly as possible. So another common example that I've seen in my practice is female patients who are dealing with more of an estrogen dominant type pattern. So this would be patients who come in saying, I've got all these crazy symptoms with the complex chronic illness, and I also have really heavy menstrual flow. I have really crazy premenstrual period symptoms. I get a lot of breast tenderness. And so when I'm talking to them saying, well, that all sounds like possible estrogen dominance, we should probably address that. Sometimes I get a bit of pushback saying like, yeah, I can deal with that. I've been dealing with that my whole life. Or you're not hearing me. I can't work and I can't take care of my kids and I can't do this and that. I've got all these crazy symptoms. And so I'm, usually not quite that dramatic, but, sometimes I get a little bit of pushback where they're saying like, well, I don't want to work on balancing my hormones right now. I want to work on, killing these microbes or whatnot. And so again, in a similar fashion to what I was saying with the digestive tract issues that might be underlying, or might have been pre-existing before they became really ill. Something like an estrogen dominance can be a significant factor that gets in the way of a patient getting better faster. Too much estrogen can beget more inflammation in the body. Too much estrogen will hypersensitize histamine receptors, and that can really exacerbate symptoms of histamine intolerance, mast cell activation syndrome, which can be a big underlying feature of mold illness and Bartonellosis, SIBO, things like that. And elevated estrogen is also something that in and of itself can make the immune system more hypersensitive in general. So if folks have microbial hypersensitivities or food sensitivities or things like that, which for those who might be working on, of course, maybe dietary modification, but also things like low-dose immunotherapy or other things to that end where there's more immunomodulation needed, then if we don't deal with that estrogen dominant picture, it's going to be a lot harder for that patient to get better. So, so looking at underlying past hormonal issues can be a clue as well. The third and final example, which I'll just mention very briefly, is that if there are pre-existing skin issues, so patients come in, again, saying, I've got all these crazy symptoms, I want to deal with those, but oh, by the way, I've had acne for the last 30 years, or eczema or psoriasis. Again, compared to having crazy debilitating symptoms, those skin issues seem like nothing worth mentioning. But if they have those, it suggests, well, what's going on with your lymphatic system? What's going on with your microbiome? What's going on with your detoxification systems? What's going on with those various things? Because again, it gives me as a clinician a big clue as to what the physiological blockades or weaknesses or susceptibilities or what have you might be that's interfering with them getting well as quickly as possible. So there are other examples as well, but those would be three of the big ones. So pre-existing digestive issues, hormone issues, and skin issues can be a big clue. So I hope that information is useful. Please stay tuned for part 5. I don't know how many parts are in this series. There's definitely a 5th one. After that one, I'll see if there's a 6th one, but hopefully this is all interesting and useful for you to listen to.